Acne. It's a problem all women, no matter their age, can relate to. Now, while it may start in our hormonal teenage years, the issue can reappear over and over. I know this. So with us discussing effective ways to manage and control acne, including the more severe forms, is Dr. Sherry Ingraham, a board-certified dermatologist from Advanced Dermatology with multiple offices and locations throughout the greater Houston area. Good morning, doctor.
Hi, thank you for having me.
Thank you so much for being here, because I know this is a topic that a lot of women and teenagers can relate to. So let's just talk real quick, the definition of acne, what it is, what causes it.
Right, so acne is a chronic disorder of the pilosebaceous unit, which is essentially a hair follicle and its associated sebaceous gland. And it can manifest as pimples and papules, or comedones, which are what we think of as whiteheads and blackheads on the face, and even cysts and nodules. And it tends to occur in what we call sebaceous areas. So these are the face, the shoulders, the chest, and the back.
And it affects in terms of many different ages, right? It's not just, you think teenagers because of the hormonal changes, puberty, but we're talking from maybe 8 to, who knows, right?
Right. We know that greater than 90% of adolescents get acne, but what we're realizing now is that adult men and women get acne, especially adult females, and we're getting more and more studies showing that adult women are particularly burdened by this disease, and it causes a lot of emotional distress, as you can imagine.
It does, and I've seen it in young girls where it bothers them, and that's where this question comes in. At what point do you think someone with acne should then say, okay, let's get professional help, as opposed to just putting creams and trying this and that?
It's a very good question. You know, we see patients brought into the dermatologist, and we recommend they seek dermatologic care when their acne is inflammatory, when it is severe, because this can lead to scarring. And my job as a dermatologist is absolutely to prevent scarring, and early intervention is key. Also, if they've tried over-the-counter preparations and they aren't getting results, and most importantly, if a parent notices that a child is becoming withdrawn or depressed because of the appearance of their skin, they should seek the care of a dermatologist.
And you hit a good point, because you can go to any drugstore, and there's just a plethora of treatments out there. And I've seen a couple of teenagers that I know, my nephew, for example, who has tried so many things. So what have you found, because you have seen this, you are a pro here, that is an effective way to treat acne, so that someone can feel like they're getting the right thing?
So if they have mild acne, what we think of as whiteheads and blackheads, which are comedones,
which is common,
right? Really, first-line therapy is a topical retinoid and perhaps a topical benzoyl peroxide with a combination topical antibiotic. However, if they're developing severe inflammatory lesions, then we need to think about adding an oral antibiotic such as doxycycline or minocycline. And we give these antibiotics not only to treat the underlying bacteria, but also because of their anti-inflammatory effect.